Hey guys, have you ever been to visit your dentist and really not understood what it was they were saying? The treatment didn't make sense and you just sort of like tune out or you nod along and you're not really sure what just happened there. If that's the case, I mean, of course, sometimes as dentists we don't mean to do that, but we really talk in terms that we don't realize that aren't common knowledge. And I really want to kind of help you in some way understand these things in very simple terms, so that very common terms that I hope will help improve your understanding. So here goes. So I wanted to give you a couple little quick, like a little glossary of some terms that we use sometimes when we're talking to each other that maybe we don't explain to patients. The first one would be diastema, for example. Diastema is simply just a gap or a space between two teeth. Attrition is simply when two teeth or a tooth or a number of teeth are worn down on the biting surface or on the edges. And so we say, that person's suffering from attrition. I'm not sure how much that makes sense to the patient, but I think it's important to explain that. Recession is when it's as if the tide has gone out and the gums and the bone went with it and it did not come back. Vertical maxillary excess. I know that sounds a little crazy, but it means when you have a lot of extra tissue or bone up in this area. So when you smile, your face is very long here and very gummy. Mixed dentition. Simple to us, but mixed dentition just means that the teeth are in the mixed phase of developing. So they're between the baby teeth and the adult teeth. So this person or this patient is usually somewhere in the ages of 5 up until can be around 12, 14 years old, especially. That would be the ages where you would see that. Erosion, of course, a lot of people know about that in other ways, but erosion is as if there's like a little pothole in the surface of the tooth. And erosion actually happens in a lot of cases where there's a lot of acid in the patient's diet, or it's a lot of an outside enamel is gone, and now we're starting to see the inside layer, which is the dentin or the yellow part of the tooth. Well, gingivitis is something that's commonly talked about in the dental office, but I'm not sure everyone really explains it so that the patients understand. So what I want to say is that think of your gum tissue as a turtleneck for your teeth. So the gum tissue surrounds your teeth, and in between your tooth and the turtleneck is where the bacteria can sit. If they sit in there and they're not flossed out, particularly through flossing, but brushing of course as well, then they will actually poop acid. That acid will actually make a little hole in the lining of your turtleneck, and no one wants acid or holes in their clothing, right? So that acid, that little hole then starts to get bigger and deeper and deeper and can literally go down into the bone. That's a more advanced type of gingivitis called periodontitis, but we're not even going to go there right now. What we want to do is explain to you that the gingivitis is really just holes in the lining or the turtleneck around your teeth, and those holes will heal if you remove the bacteria on a regular basis through brushing and flossing. Abfraction lesions. It doesn't really explain itself. A lesion, of course, is something bad. You've heard that before. It's a hole or a spot, an area. But an abfraction occurs when something is moving or flexing or bending. And what happens is there's like a hole that gets formed at the gum line of teeth because they are flexing or bending. It happens often in people who have crowded teeth, or an area where there's a tooth missing and then the other teeth have kind of fallen into the space. So you'll see that those teeth are more prone to this problem. And what happens is the tooth is getting pressure from the above teeth in a way that is not favorable to the tooth. So just because the tooth is there, it can handle so much force, things start to break down. And they start to break down at the neck or around just above the turtleneck of the tooth. So if you think of the gum tissue as the turtleneck, it's just above that. But then it starts to creep its way down, and literally the gum tissue will start to move away from the tooth in what's called recession, but then we start to see a scooping out or a hole in that area. It can also then become prone to a cavity or decay and very rapidly erode or kind of get bigger. Another term we use is incipient decay. Now, Incipient means early, and decay means a little hole or a break or a weakening of the wall of the enamel. So enamel, of course, is the white part of your tooth. The weakening happens and it starts to show up on those little x-rays that we take when we do your checkup. We start to see a little shadow, but that little shadow is still not very big. In fact, it hasn't even reached this critical point in the tooth where we know then we have to treat the cavity. But if it's still in that early stage, we'll call it incipient decay. So what happens is there's a great opportunity here, and you'll see I personally and my hygienists definitely get excited when we see it, because we know that we can help you save your teeth by flossing more, applying a topical fluoride rinse, or using fluoride in your toothpaste. That will then help reharden those little spots, and we get the opportunity to say, look, this can be reversed. You have about 6 months to a year for incipient decay to just sort of sit in that zone. It takes anywhere from a year to 2 years to really show up as a major or a more identifiable true cavity. And it's in that point that then, of course, we have to do the filling. But if it's really in that early stages when it's just starting to form in the first 6 months to 12 months, then there's a great opportunity where it may actually halt in progression or be reversed and rehardened in the enamel. So this is why we really encourage you to come in for regular checkups, especially not going much longer, anywhere from 6 months to a year, because we can really catch these things early, help you, find ways to reverse this problem and, avoid the hassle of cavities. Root canals. Root canals are not the greatest term, I realize, because we think of pain and the words they don't really explain what we're doing. But I try to explain it to patients in a way that, we're just doing a filling, but we're going a little further, because a lot of the problems that are required, or when a tooth needs a root canal, the problem is usually a little further in. Now, people think of that as pain, but if you're properly frozen, that is not going to be painful. I've done many root canals, and very rarely do we ever have any issue with pain. So once you're completely frozen, then the dentist is just basically performing what seems like to the patient just a filling. So if you've ever had a filling done, or you've had to lay there, you have a rubber dam on, you have this little thing over the tooth, and it just allows us to go into the tooth very safely. We apply some special rinses to the tooth, and we clean the tooth on the inside, not just like we would clean a tooth, like a hygienist would clean a tooth on the outside. We're actually cleaning the tooth on the inside, and by cleaning it on the inside, we're removing the little bugs, bacteria, if you will, that are living there that are causing your tooth to feel very uncomfortable. And most patients right after or within a week have absolutely no discomfort from a tooth that may have been giving them trouble. The whole appointment should be fairly simple. It's a really great way to save your tooth. Your tooth does not have to be removed, and there's no need to replace teeth, but we're going to just clean the inside of the tooth. So that's what a root canal is, cleaning the inside of the tooth and then putting a filling inside the tooth. Cross bites. A lot of times in children as young as 4, 5, 6 years old, we will see what's called a cross bite, and we'll say to the parent, oh, they have a cross bite. And I don't know why, but sometimes we think that the parents understand what we mean. So I'm going here to clarify. A cross bite, well, if we think about a bite, so your very bite is the way your teeth fit together. When you're in a cross bite, your bite is in the reverse. So the bite is in the opposite direction or the opposite position. So that can happen on one side of the mouth, but it can also happen on both sides of the mouth. If it happens on both sides of the mouth, it's certainly an issue that we will want to address very early on. Sometimes if it's only on one side, we will monitor that, or we'll wait a little bit longer. But ultimately, what it can mean is that the jaws are now being directed to close in a way that is abnormal. It can lead to other problems later on, and future teeth, when they're developing, can then end up in this crossbite situation. So a lot of us dentists and orthodontists we will want to correct it, because in early stages, it's like anything, in the early stages, we can actually have more success and improve things than we can if we wait till you're an adult. Clefting. So clefting relates to the tooth where the gum tissue is, and the gum tissue is forming a V notch or a V shape around it. So everybody's teeth have a nice sort of, what we want is a nice C shape, but if it's a V shape around the gum tissue, then it's really showing that the tooth's under a lot of stress, and that's called clefting. It's active form of recession, and it means that the tooth's in trouble in some way, usually because the tooth is being having force on it in a non-favorable way, and may require the tooth being moved into a better position or the bite being adjusted a little bit. Thanks everyone for tuning in. Please like and subscribe if you'd like to see more content like this. Until then, I will see you next time.